So our first speaker is Dr. Manish Pandya. He is professor and head of the department from Scientific Research Institute, Surendranagar, and he'll be speaking on role of 20 to reach 20.
Hello. Good afternoon. Thank you POGS for giving me opportunity to share my views on this topic. This is not working, boss. Excuse me. This is not working. Thank you. So my time starts now. I would request that everybody should register themselves on ORCID. It is a very good site. Thank you for kind words, madam. These are my publications. Welcome to Pune ART. How beautifully everything is arranged by Almighty. That as soon as child born, mother is ready to take care of it. She is existing. Mother is something you said by Rajnish, and we are in the Pune. So thanks to Rajnish. 3 books written by me is recommended as a reading material in Royal College, and these are Atlas of Fetal Echocardiography and IVF Made Easy for second edition. I will invite all researchers to take part in these 2 journals, Indian Journal of Obstetrics and Gynecological Research and Open Access Journal. Today, 2020, everybody is playing IPL, Pune is also witnessing 2020. So let's talk something regarding 20 till 20. Within this 15 minutes, I would like to emphasize the importance of safeguard of crucial 20 week of gestation, addressing the progesterone deficiency and what about the high risk, using which dydrogesterone and why should it be for 20 to 20 and choosing the right dydrogesterone. We all know that pregnancy is a joyful event, usually kept secret. Recently we had seen the movie KGF, how beautifully she narrated that she is pregnant. So now every woman has got dream to become pregnant, and when she pregnant, usually it is a joyful event. They will reveal to some person, some doctors, and sometimes it's kept secret. We all know that in olden days, everybody knows that when live birth is start, that is quickening. So at 20 weeks of gestation, there is a quickening, but believe me, one of the 5 pregnancies complicated before 20 weeks of gestation, and it is by threatened abortion. What we mean by threat? When there is urine pregnancy test is positive, no passage of product of conception, cervical os is closed, and there is no evidence of fetal embryonic demise. That we call it as threatened abortion, and 50% of threatened abortion end in miscarriage. If we see by literature that incidence of threatened miscarriage is more than 3 times, and risk of threatened miscarriage is more than 4.5 times higher in women with recurrent pregnancy loss compared to healthy pregnant women with no history of RPL. So it is a global burden. 26% of pregnancy, 10% of clinical recognized pregnancy and in miscarriage. If we see scenario in India, and this is our own paper by Amit Patki and et al., that spontaneous miscarriage rate is 10 to 32% are higher in Indian women compared to Western women, and prevalence of recurrent miscarriage is 7.46%. So women with threatened miscarriage and history of recurrent pregnancy loss are at higher risk of adverse outcome of threatened and history of recurrent pregnancy loss. We all know that literature refers that inadequate secretion or lower level of progesterones are the utmost important of subsequent miscarriage and threatened miscarriage, and it is the main cause of miscarriages. So we all know that progesterone is the hormone, and we have to thank our mother that our mother has generated enough amount of endogenous progesterone in us to nurture us. If that is not, then we are not born in this earth. And maximum investigations or maximum things are done in progesterone. Since the genesis of Pincus has designed the OC pill, ethinyl estradiol remains same. There is all difference are in the progesterone, because progesterone has got the maximum effect, and those who have got maximum effect has got maximum side effect. That's why most of the investigations are done on progesterone. We all know that ovum is released from the ovary, engulfed by the fimbria, resting in the garden of ampulla to meet handsome sperm, like is like a race. One beautiful sperm going for the handsome ovum. I am depicting the dictums. Handsome sperm is going for the beautiful ovum. Beautiful ovum is unigamous. One is gone, it's shut down. then there is a binary fusion 2, 4, 8, then there is a blastocyst. At the level of blastocyst, we are implanting ourselves into an ocean of endometrium by the maximum implantation potential point. We are eroding the endometrium. We are putting ourselves into the endometrium. माँ का खून पी के हम जीते. So this is a phagocytic event. Since cytotrophoblast is phagocytic and cytotrophoblast is making the chorionic frondosome. Condensation of chorionic frondosome becomes cotyledon and condensation of cotyledon becomes placenta. Why we are talking about this? Because this is generation of progesterone. Corpus luteum is the mother of progesterone. It will nurture the pregnancy up to 10 weeks of gestation. Then it's taken over by placenta. So this progesterone induces changes of secretory into the proliferative. Wow, boss. Proliferative into the secretory endometrium or pregnancy conducive endometrium. When we are talking about pregnancy conducive endometrium means what? There is a triple line becomes a ground glass appearance. There is a formation of pinopores. There is a formation of integrins alpha b beta 3 and there is formation of osteochondrin which has got very love for this ovum or embryo when we are implanting ourselves. So progesterone regulates the balance of cytokine, influence the activity of natural killer cell and it suppresses the contraction in the uterine cavity. So we all know that pregnancy is an anti-inflammatory event. Pregnancy, when blastocyst breaks into the lining of the implantation endometrium, damages and invade inside the endometrium and resulting in a live cell. So inflammatory response are the stew of pregnancy. We have to thank Professor Raj Raghupati who has designed beautiful concept of allogenic immune response to paternal antigen. Madam, we all born from one chromosome from our mother and one from father. Madam, ladies is very settled, just like table. Why? Because they have got 2 eggs. Male has got 1 Y. क्या करे बेचारा? एक टांग पे खड़ा है तो कभी इधर कभी उधर. So that is a natural, है ना? Joke apart. So this we are born from cytoskeletal. We are born from because our mother has generated enough amount of immunomodulation, that is positive immunomodulation. In this COVID era, everybody talks about antigen antibody reaction. When we are implanting ourselves into the endometrium, it is just an antigen antibody reaction. Sometimes this uterus recognizes this embryo or sperm as an antigen. Against that antigen, antibody develops. We all know Robin's pathology, second MBBS, T cell, B cell lymphocyte, Th1 cytokines, Th2 cytokines. When there is formation of Th1 cytokines, that is elder brother, that is inflammatory response. Whenever there is inflammatory response, there is formation of TL2, interleukin 2, interferon GARFA, natural killer cell. So there is formation of symmetric antibody. There is formation of increase in the natural killer cell. There is formation of tumor necrosis factor alpha that cause inflammation. So at that time, uterus reject embryo. There is a beautiful paper by Park and et al. In 1990 stating that why your mother has rejected you. That are doing the embryological implant, that there is an inflammatory reaction to that embryo. And now Kundan has presented this much of study. You know that when an endometrium is not good, even though good blastocyst doesn't implant, that is the purpose of our talk, thin endometrium. When soil is not there, no crop will survive. So we have to thank Almighty that our mother has generated anti-inflammatory response and that anti-inflammatory response contains interleukin 4, 10, tumor necrosis factor and PIVF and that is for successful pregnancy outcome. So our mother has generated enough amount of Th1 and Th2 cytokines. It has suppressed T cell reaction and prevent ourselves into the uterine endometrium. So for successful pregnancy, there should be anti-inflammatory response and there is increase in the PIVF for progesterone to increase uteroplacental circulation, suppresses uterine contraction and provide very good luteal phase support. So progesterone is key for the development of maintenance of pregnancy. That's why it is progesterone. For gestation to come, proconception to come, there is a progesterone. So it has got significant role in establishing an adequate immune environment at the early stage of pregnancy. It experts immunological pregnancy positive effect in the cytokine production and deficiency has been associated with insufficient endometrial maturation and inadequate regulation of inflammatory cytokines. So we all know that progesterone deficiency causes this type of things. So it is a high risk pregnancy. So there is a justifiable interest that we have to give progesterone support to all this pregnancy to nurture in utero. That's why 20 till 20 milligram of dydrogesterone till 20 week of gestation. And I love this paper, Kundal, because women with less than 35 nanogram of progesterone are 23 times more likely to experience miscarriage. Recommended by arabetol that oral progesterone, namely dydrogesterone, are well tolerated and effectively reduces miscarriages in women at the risk of threatened and idiopathic miscarriage. And the sentence, progesterone therapy, especially oral dydrogesterone, effectively prevent miscarriage in pregnant women with threatened abortion, that control treated group. I am happy to share that now I am coming in citation. This is my paper in 2016. So we have to choose progesterone. And there are armamentarium progesterone in our market. Oral, intramuscular, micronized vaginal and oral dydrogesterone. If we use oral micronized progesterone, we all know that it has got low bioavailability, such as drowsiness, dizziness and headache. Intramuscular, that is injection site pain and threatened abscesses. Micronized vaginal progesterone associated with high administration side effect and vaginal irritation. So things remain is oral dydrogesterone, and since 2000 I am 21-year-old with dydrogesterone. When Dil Dufar was there, I am talking about dydrogesterone. Now I am mature, I can vote for dydrogesterone because 21 years I am speaking on dydrogesterone. So potent oral progesterone with impaired bioavailability. If we compare the dydrogesterone with oral micronized progesterone, dydrogesterone is approved in pregnancy indication. It has got global viability more than 100 countries, better bioavailability more than 28%, less side effect, pregnancy outcomes are more. Dydrogesterone induces nitric oxide synthesis. When citrulline converted into arginine is converted into citrulline, there is formation of nitric oxide, and there are documented trials. So dydrogesterone has got more immunomodulatory effect. Dydrogesterone induces anosynthesis, improve uterine blood flow, increase placental circulation and improve endometrial receptivity, and there is a very good pregnancy outcome. Again, this paper says with Manish Pandya that there is no suppression of pituitary gonadal axis, helps circumvent the inconvenience and discomfort of intravaginal or oral micronized progesterone, high bioavailability, it gives endometrial transformation at 10 to 20 times lower dose, minimal side effect and high selective progesterone receptor with low androgenic side effects. And this is my paper I am talking about. You can take from this paper of Abbott. This is the paper. So it increases PIBA production, increases cytokines, shifts from TH1 to TH2 and protects fetus. And thanks again Parag for giving me opportunity to meet Raj Raghupati and Professor Howard Kapp when I got this conference in Pune. So dydrogesterone 20 milligram till 20. There are lots of data. This is paper by Howard Kapp. The reduction is 47%. When we use dydrogesterone, it is a real indication of the treatment, and this is with Professor Howard Kapp in this same Pune. So thanks again to Biniwal family. Hams and Rasmi, Kapp, Avalzibe and Kumar all said that we have to use dydrogesterone to decrease the miscarriage rate 20 milligram till 20 weeks of gestation, and this is the marathon of paper. This is paper by Pandian that it says 40% control rate, it's good. 95.90% there is a pregnancy treatment group, we can save pregnancy. This is Kumar Bhai et al. This miscarriage rate is 6.9. So there are more safety data on dydrogesterone because it is highly selective. Most of studies has proven that, and it has got very less drowsiness. So use of variety of indication worldwide, only few slides. So European progesterone study has recommended dydrogesterone, and our FOXY has also recommended that oral dydrogesterone 10 milligram 20 weeks of gestation to prevent the recurrent pregnancy loss. I am happy to be a part of FOXY progesterone treatment in National Task Force. Recently we had done the guideline of progesterone in endometriosis in Jaipur, and this is paper of Professor Grisinger. So choosing the right dydrogesterone, because we have got innovator dydrogesterone with us since last 60 years. First known pregnancy was occurring in 1960, 110 markets, more than 20 million babies born. There is no cardiac side effect, and I am happy that I visited the WIST facility at the Netherlands, and they are giving the least minimal impurities with the dydrogesterone, and certificate of suitability is there. So Abbott dydrogesterone is only dydrogesterone, has got global acceptability certificate. It has got more than 3-year half-life, more than 600 articles, and it is approved for use in LPS and IVF. Number 1 progesterone, more than 2 crore pregnancy and 600 publications. So this is the last slide. Can you play the sound? Please play the sound. Not possible? Hero?
Shaking, he's shaking.
Okay. So it's about this ashram. Okay, no, thank you very much for giving me opportunity to share my views, and thank you very much. And I am also thanking this podium to giving me opportunity to share my views. And this is one last slide. Then I'm just 1 second. Boss. So this is people are making GIF, and you can see downstairs there is a name. So thank you very much. I am in the GIF also, and your own candidate is for the Foxy president. Thank you very much. Thank you for giving me opportunity to share my views. Thanks a lot.
Thank you, Dr. Manish, for making such a serious topic so interesting and thrilling. May I invite Dr. Ashish